Hello, everybody. Welcome to Dental Voice, Season 2 with Zyrus. Thank you for joining us. My name is Rolando Mia, and today we have a returning guest. The purpose of Dental Voice is to hear directly from professionals in dentistry and kind of hear from them perspectives, observations, opinions, and get some advice. We got some phenomenal feedback from our guest, Dr. Dan Roberts, almost 7 months ago, just as we were entering into this pandemic, COVID, and all that type of stuff. Dr. Dan Roberts is the owner of Encinitas Perio down in San Diego, and really excited to have him here. Good morning, Dr. Dan. How the heck are you?
Good morning, Orlando. I'm well, thank you.
First of all, thank you so much for joining. I'm really looking forward to kind of understanding what's happened over the past 7 months and then share with us what's working, what's not, and then maybe some more advice. Is that cool?
Oh, that sounds great.
Awesome. All right. So before we begin, I happen to find something that I'd like to share with our viewers here. So everyone, early in the process of this, Dr. Dan and his office were highlighted by KPBS, which is a local radio station. So what I'd like to do is share with you the short interview or video that was done, we're talking 7 months ago. And then Dr. Dan, I'd love to understand your thoughts around that. So let me go ahead and add this here. There you go. Check this out, everybody. Listen to this.
Dan Roberts has a periodontal practice in Encinitas. He's looking forward to seeing patients again, but he knows it'll be different. Roberts says the best way to beat COVID-19 is to keep it out of the office.
And that's where we do the questionnaire over the phone. We take a temperature outside before the patients come into the office. We have them wash their hands with hand sanitizer before they come in.
COVID-19 is spread in the air, and some of the high-speed tools like drills and scalers create aerosols that can carry the virus. Roberts and his staff will wear masks, medical scrubs, and gloves to prevent transmission. They also plan to use specialized tools like this ISO-light for surgical procedures.
These little holes work as suction. It also has a light. Very cool. So it makes a dark hole light. It creates a barrier and it creates suction.
Roberts is currently only taking emergency patients. He's eager to begin seeing patients again because he's still paying bills to get ready for the new normal, but his incoming revenues have stopped. The new tools and processes won't go into effect until the California Department of Public Health clears the way to reopen for more regular procedures. Dentists would also like a little peace of mind about their patients, and that can only happen one way.
And then we also would like to test patients to make sure patients don't have the active virus currently, which is an antigen test, as well as being able to do an antibody test to see if they've been exposed.
Nagy says dentists want to get back to serving people, but they know they have to do it in a way that protects themselves, staff, and patients. Eric Anderson, KPBS News.
Wow. So Dr. Dan, how was that experience? That was almost 7 months ago. What has changed? And kind of, if you could share with us kind of what's going on with your practice since then.
Well, it's just listening to that. That's the first time I've heard that actually all the way through since in the last 7 months. And it's kind of interesting because at that time, it was a pretty scary time. We really didn't know what was going to happen. We didn't know how virulent COVID was. And you have to remember, I was scared. My team was scared. Our patients were scared. And, I didn't know when we came back, are we going to be seeing 2 patients a day? What's it going to look like? So luckily we gained some more information and really we did exactly that. We started with the approach that first and foremost, we want to keep COVID out of the office.
Right.
But then we had to take it a step further. We had to make our team feel safe because I was getting some serious pushback from my team, and when the state said, hey, dentistry can come back and open back in, it was mid-May, May 13th, 14th, I had some of my team saying, hey, Dan, with this stimulus package that our government has given us, we're really financially okay. Why don't we come back in August when the stimulus package expires? And I said, well, that's great, but our patients need us now. And I didn't think we'd have a business to come back to if we waited that long. So we push forward with what do we need to make our team feel safe, second most. And then finally, what do we need to make our patients feel safe? Because they're hearing all kinds of horror stories. You turn on the news, and at that time it was, body bags in New York piling up.
Right.
So, who the hell wants to go to the dentist? Anyway, here's some of the things we did. I think in the video I mentioned a health questionnaire, health screening that goes out to the patients, and it goes out through our RevWell. And so the computer generates the same computer that spits out the confirmation for the patient. So they get a text or an email, and this medical questionnaire. They fill out the questionnaire. It's like 5 questions, and they send it back to us. It goes right into their chart. And it's all the basic stuff. Have they been traveling? Do they have a fever? Have they been exposed? All that. I recently went to a medical appointment, and they had all that stuff on their answer machine. Like before you could talk to a personnel, it was all the questions. And I thought, this is just a big barrier for getting to their office. I just want to confirm my appointment, and I have to listen to 30 seconds of them talking about this and that. And then if you have a medical emergency, go call 911. It just seemed a little overkill. I wanted it to go out, make it easy for the patients, and it is. The next thing, I have some of my friends actually lock the door, and we did too initially when, we had our door locked. Patients would come, they would call or text us from their car, and we would go out and meet them outside in the out front the office, take their temperature, give them hand sanitizer. We don't do that anymore. They are able to come in to the office now. But we definitely changed our scheduling. Before, my associate and myself both worked on the same days. We worked 4 days a week together. We had a pretty big team to make that happen. We changed that. We split our schedules up. We have 1 day a week where he works in the morning and I work in the afternoon. And now we're starting to open our schedules a little bit more, but really we've reduced patient flow in the office. We take so hand sanitizer, the health questions. Oh, the other thing that I don't know that we were that I was even thinking of at that time, but there was articles that mouthwash was effective, and certain mouthwashes. We use peroxide mouthwash. So patients rinse for 30 seconds before they jump in the chair. Those are the ways that we keep COVID out of the office. The next thing we do is making our staff feel safe is the PPE, all the stuff that we had to get for that. And I know every office has had to do this. It's the hat, the gown, the face shield, all the stuff, the booties, you name it, we've got it all. And then the mask was a whole big thing. It's like, can you wear this N95 mask? They're miserable to wear. But we've got all that provided. We had to get gowns for our team. And so I have to say that makes dentistry a bit more tiring than it's ever been before. And face shields, you've got glare, you've got echo, it's making communication between patients difficult. and at first it just seemed impossible, but we're working around it, and now we're doing it. The other thing that was mentioned on the KPBS interview is the isolate, and we definitely use that. My hygienists use that all the time, and honestly, when I get my teeth clean, I want that thing in my mouth. I used to think, oh, that's a pain in the ass. It's a big bulky thing. It's really not. Once you put it in the mouth, it's very comfortable for the patient. So patients like it. It's not what keeps water from going down my throat. It keeps keeps me from having to swallow every couple of seconds. So I like it, and my patients respond well to it. And my team likes to use that. We've got the HEPA filters for them with the UV light. And I know some people, I had a guy that came over and he goes, Dan, you got to get these UV lights for your operatory and all these shields. And it kind of looked like a meat packing plant, the outline that he had. And I said, I think I'm going to hold off on that. And I'm glad I did. But I don't fault the people that went that far, because that would really help to isolate people walking through the hallways. So that hits on the last thing, is how do we make our patients feel safe? And they feel safe when there's less congestion in the office, when there's less people walking around. So we totally revamped our schedule. Everyone that walks in the office wears face masks when they're walking through the halls until the patient gets to their chair, sits down, and gets ready to work. Then they can remove their face mask. They feel comfortable with the isolate section. All the contact surfaces are wiped routinely, all the things that everybody does. The other thing is, we're blessed. We have a chartless office. So there's no paper pushing. Everything can be done remotely. So that makes it easy. Finally, we have patients wait in their cars. They come in. We hardly ever have anybody in the reception area. If we do, it's one person. Our chairs are fake leather, so they're wipeable. So we're blessed with that. At the end of the day, when we have that last surgery patient, their ride can come in and sit in the reception area. Turns out most of them don't. They prefer to wait in their cars.
So it sounds like you put in all of the things that you were talking about, and it sounds like that they're working. Are you seeing things that you put in place that you quite frankly don't need to? Or is there anything that you thought was really critical at the time and you've since discovered, you know what, although it sounded like a great idea, or the hysteria around it was, holy cow, we got to do this, we're not? Is there anything like that you can share?
There's I didn't take the bait on a couple of things. I'm glad I didn't. And the rest of the stuff, it's just background noise now. So we use it all. It's not that cumbersome. It's not that horrible to wear a gown. It's annoying. All the stuff that we do just adds a little bit to the stress of the day. But there's nothing that we implemented that we say, now we don't have to do that now.
So it's almost as if you're just kind of vamping up, or doing what you've done before, but increasing kind of the process around it. Am I hearing that correctly?
Yeah, dentists have always been real good at infection control. We've been trained at that, right from the first days in dental school. And so we come out with a good sense of infection control, and we practice that. And I think that's why, really, during those first few weeks, we were all kind of holding our breath going, okay, when is the next community outbreak going to come out of a dental office?
Right.
And I personally don't know of any. It certainly hasn't happened in our office. And luckily, you know, we live in an area where people are spread out. They're not living on top of each other. So we live in a lower numbers area. But, you know, San Diego is right on the Mexican border. There was a high incidence of COVID down on the border, and a lot of border crossing. And I've had some people tell me it was because of the Americans going down to Mexico to get treatment, not that it was
Not the other
Mexicans
way.
coming up here, that it was us transmitting to them as well as them transmitting back and forth. Anyway, I think it's mainly, it's just high density population, right, that lives on the border. And people there live in big families. And so when one person gets COVID, it's going to spread to everybody in the family just because they're living close together.
Right.
So,
Right.
So yeah, we did have some high numbers in San Diego, and Rolando, yesterday we just found out we're in the purple tier.
Yeah.
I mean, so all of our gyms, our restaurants, hair salons have been told they have to close back down again. Restaurants for indoor dining, now it's back to outdoor dining only. Hair salons, now you got to get your hair cut out in the street, I guess.
It's amazing.
And I feel really bad for those people. I don't know how you run a business where it's open, then it's closed, then it's open, then it's closed. That would be really, really troubling. So I'm hoping we can get these numbers under control. One thing I do follow closely is, you know, death rates, hospitalizations, what kind of people are succumbing to COVID, and we have definitely decreased hospitalizations. We have definitely decreased death rates, and the people that are dying seem to be pre-existing conditions. So in other words, hey, we're all going to die of something. But this was the one thing this was the last straw that pushed them over the edge. And I think for a lot of the people that are in the reports, but it's still unfortunate. I mean, you don't want anybody to have to die from anything. So we want to keep doing our part.
Yeah, there was a recent article indicating that thankfully now dentistry is not a non-essential, and that there was a message that yes, you need to get in and take care of your oral health because it's tied to your systemic health. So that's good news. I mean, dentistry went from the mecca and the super spreader of this disease to, yeah, one of the safest places, which is fantastic. Would you be willing to show us your practice or show us some of the things that you've done or that type of stuff in your office?
Yeah, I can put on my mask and take you on a walk through the office.
That'd be cool.
Let's do that.
Well, well, that's exciting. I feel like I haven't done this yet, so
I'm gonna go out to the front door and walk in as if I'm a patient, and let's see how this goes.
oh, that'd be cool. So it's pretty cool. You're down in San Diego, so you're coming out. Okay.
This is Nancy, our hygienist, coming to work.
Hey,
Happy birthday, Nancy.
happy birthday, Nancy.
It was Nancy's birthday yesterday.
Right on.
29 again.
So Stephanie's gonna meet me at the door as if I'm a new patient, and she's gonna take my temperature.
So I'm going to ask you a few questions. Have you been out of the country in the last 2 weeks?
No,
And have you been with anybody that has tested positive for COVID?
no,
Okay. And you haven't tested positive for COVID either, right? In the last 2 weeks?
no.
Okay, awesome. Come on in.
Here's
Oh, I see.
Jenny.
And you have plexiglass. I noticed that.
We have plexiglass. We have cough etiquette. We have hand sanitizer. The no touch hand sanitizer.
Very
So
nice.
we found some cool products. We have plexiglass around our
Oh, that looks
front
nice.
desk. Yeah. That's Lena, our office manager. Then I would go, and here's John, our hygienist. And you can see he's got patient in the chair with isolite in her mouth. John's wearing the shield, the gown, all the personal protective equipment.
And then where are your air filters? Is that in the back there, or?
It is, yes, it's in the back between the operatories.
Okay, very good.
So that's between. We'll show some of the other surgical ops. There's one of the air filters there. There's one in there.
So you've put one in every location. You've got that going. So you're taking care of the air through. Everyone's wearing PPE masks. I noticed there are very few people running around, and it's not as jam packed and all, which is pretty cool.
We've got face shields everywhere you look. You know, all the stuff. So that's our office.
Fantastic. That's awesome. Thank you so much for doing that. And I like the efficiency, your commentary about making it easy for the patient, reassuring them that they're safe, and not making it so onerous for them to come in, like you said, where you were asked a bazillion questions early on in the process, and you're like, I just want to schedule this coming in. I love the mindset around that in helping the patient. So it's, as far as your practice, are you busy? Are you seeing patients coming in, or are they apprehensive? What's the overall feeling that they have with regard to your practice?
I thought that it would be. I thought we're gonna just see a few patients, but quite the contrary. We've actually had. Right now, we need to find more hours to see our patients. We have decreased some of our scheduling hours, but somehow increased our productivity.
Wow.
So I have a theory about that.
Yeah. What is that? I'd love to hear.
Well, I think, let me get this thing situated again. I think some of our patients have more free time because they may not be working as much, or they're working from home, and they're thinking about themselves, and they're thinking, you know what, I want to go ahead and get that done. I want to get that cosmetic case done. They're doing more elective procedures right now. They're taking care of themselves more. So that's been a big benefit for us, and I don't know if other areas are seeing that. But when I talk to other dentists, it's not just my office. It's the colleagues in my study club. They're all telling me they're as busy as they've ever been. So
That's that's so good to hear, because there were some studies, that were published several weeks ago, a month ago, where practices are open, but they're only tracking at, 70, 80%. It's interesting that you noted that you're seeing fewer patients, but your production is actually higher than it's been. So, and it sounds like you're doing more for each patient, but you have the time to do that. And it sounds like your patient is willing. Is that what I heard?
that's it. I mean, we just have patients that are they're ready to do it. They have a little more time on their hands. I mean, dentistry, especially comprehensive dentistry, it's a process. It takes some time, and it's more than just money. It's time for a lot of my patients, and
Right.
now they have it. Plus, they can be walking around in a mask. The cosmetic part of it isn't as scary to them. It's like, oh, what if I, am I going to have to wear this flipper? What if I have to do this? What if I have to do that? They're going to be wearing a mask. What if there's bruising? What if there's swelling from what you do? Who cares?
That's
Get
right.
your mask on. Nobody's going to see you. So it's. I think that's what they're thinking. It's just like, okay, there's never been a better time for them.
That is so good. So it sounds like, as far as your team, as far as your practice is concerned, as well as your patients, there's definitely a focus. And I noticed as we were taking a tour of your office, everyone was wearing a mask. You've got the shields up to minimize droplets. You've got your air filters. We see you're using the isolite over there, which is really nice. All the PPE. So people recognize that there's an issue, but it's not. People aren't freaking out anymore. Is that what I'm kind of hearing from you?
I that is the case. I do still have a couple of patients that are still not comfortable coming in. I have one patient and his wife, been patients of mine for some time now, and he feels so strongly about his commitment financially that he doesn't come in for his maintenance visits, but he pays me as if he did. And he sent a long letter, and he just said, I feel this is, that it's important for me to support the people that take care of me. And I'm sure he's doing this for the restaurants that he frequents and stuff too. And he said, I don't feel comfortable coming in yet. And, but I'm going to support you anyway. And he sends a check, and I put it on his account as a credit. But, but I just think that's just heartwarming,
Yeah.
And I wish I could alleviate his fear, but there's always risk. There's, knock on wood, we have not had any problems, and nobody I know has had problems at a dental office. But that's not to say it's impossible. We do everything that we can, and I think our risk is extremely low, and I feel more comfortable as each day goes on. But I tell you what, that first month, each person that came to the office, each one of my team members, it took them a couple of weeks before they felt like, okay, this is routine. I mean, just everything. It was like the jitters around here. It was tough. So I'm glad those days are over. I'm glad it's back to business as usual. And I'm glad that so far we've proven to ourselves that yes, everything we did is working, and we're keeping a safe environment.
So awesome. And I do recall, and I actually got a note about it. You gave members of your team toilet paper. And it's funny to think about the fact that, wait a minute, I actually got a comment back says, oh, that was so nice. One of your doctors gave his team, and you're kind of, what?
I forgot about that.
Because remember at the time when we were talking, I was like, people must have been eating at that stuff, and now it's available. But you said, you know what, they couldn't get it, so I open up the office, and I'm like, oh, how nice. And I'm thinking, isn't that funny? I'm thinking, oh, how nice. He gave them toilet paper. I
we,
mean,
we,
that's
we gave him more than that too.
that is so, but also it's heartwarming to your point, your patient saying, I want to support it. I recognize it. I'm not comfortable, but I also know that, people have to live here and I have the means to, so I'm going to do it. And I think that's a great message. And boy, oh boy, that made me so proud. If you were to kind of sum up, and if you were to kind of send a message out to the community, to your patients, to your team and other colleagues around, what is it that you'd like to say as we kind of close this out, and what's the message you'd like to get to them?
The one thing that's come out of this is some unintended benefits. Besides being less traffic, I think that we're healthier. People aren't coming in with common colds and flus, so that's healthier for us. I think this has caused us all to look a little inward. I've had
Right.
2 of my full-time people have gone down to 3 days a week because they've got other interests that have evolved out of their 2 months off. I think we found that we need less stuff, and so we can survive on a little bit less income. Anyway, it's just I think that this gave us a chance to look at ourselves and really see what we want out of life. Besides beyond dentistry and beyond work, what do we want for ourselves to make ourselves and our family happy? So that's some of the unintended benefits of COVID, and I'm happy that we're getting through this, and I think that if we continue to use our precautions, we'll get through this. Everybody does.
That is cool. Thank you so much for that, and really appreciate it. I love the message, and I like the context of unintended benefits and seeing inside of us. And you hit it on the nose. It's important because it makes us realize what's important, and that's really cool. If people wanted to get in touch with you or reach out, or what would be the best way to get to you or your practice?
Our website is encinitasperio.com or dan@encinitasperio.com, office@encinitasperio.com. Those are the emails to get a hold of us here.
Awesome. Well, Dr. Dan Roberts, first of all, I want to thank you so much for taking the time. I very much appreciate you giving us a tour of your practice, introducing us to your team. It sounds like things are going well for you. Also, really appreciate kind of you sharing the things that you're experiencing or not, as well as the things that you like and what are working for you. So thank you for that. Months from now, I don't know, another 6 months as we get in more, would you be willing to come back and then kind of give us another update on how things are going? Would you be up for that?
You bet.
Awesome. Well, thank you so much. Hey, folks, those of you who are watching, and if you like this content, please share. If you have any questions for Dr. Roberts, please reach out to Dr. Dan at Encinitas Perio down in San Diego. Please, sir, have a wonderful rest of your week. Be safe. I look forward to hearing more for you, and it's fantastic. And thank your team for sharing a little bit of their day with us.
You as well. Take
care. Appreciate it.